Hi. So we are now going to talk about class 3 drugs. We've talked about class 1. So SAD, that is sodium channel blocker, mainly. Beta blockers is a class 2. KICS. So KICS matlab K is for potassium. So now we are going to do the third one. Class 3 anti-arrhythmics, jo ki hai potassium channel blocker. So these are the various potassium channel blockers like Emyodrone, ibutilide, dofetilide and sotalol. Then we have some newer blockers also which have come up like it's dronedarone. It is actually a derivative of amiodarone only. So it's a derivative of amiodarone, but it is less toxic as compared to amiodarone. Then Vernaculant, let's talk about these newer ones first. It is also a potassium blocker as well as a sodium channel blocker. दोनों channels को block करता है basically. ठीक है? And the important point about this drug is it only acts on the atria. So it will only take care of the atrial fibrillation. It doesn't have any effect on the ventricles, so it takes care of, it is used only for atrial fibrillation. Now, esimilide and tedesomil, these are both the trials are going on. So, under investigations or trials for the management of these conversion of atrial fibrillation to sinus rhythm. Trials mein hai. This esimilide has less chance of Torsades de pointis as such. Okay? So, these are a few important points about the newer agents. Now, we'll come to the older agents which were there initially also, which are used. So first let's talk about their general action. So their general action is potassium channel blocker, and you know what happens. Where is potassium channel important? So this is 0, 1, 2, 3 and 4. So this is the phase of repolarization, and this happens when there is efflux of potassium ion. So if you block that efflux or slow it down, the repolarization slows down. So क्या हो जाता है, जो आपका repolarization is prolonged. So phase 3 is prolonged. You remember what we discussed? Whenever this repolarization is prolonged, it actually leads to chances of arrhythmia, because at जब repolarization जब prolonged रहता है, so क्या होता है prolong होने से the sodium channels which are in the inactive state, they start coming to the resting phase, and a strong stimulus has a tendency to activate them. So there is chances of after depolarizations. So in case it's a strong, normally normal heart में नहीं होगा, but if it is an ectopic focus है, कोई infarct है, that can send, because they get depolarized and they send stimulus, ठीक है? So they can send stimulus, and that can lead to after depolarizations, usually the early after depolarizations. And this is a dangerous conditions like Torsades de pointis can occur, because जब इतनी depolarizations होंगी, that will be passing on to, in the ventricles as such, that can lead to dangerous ventricular fibrillations, and it can lead to death of the patient also. So इस group का the major drawback is Torsades de pointis, right? Now Emyodrone is a drug which is one of these drugs, and it's peculiar in a fashion. It's a very wide spectrum drug. So by wide spectrum, I mean it has properties of all the first 4 classes. So it has a property of class 1, class 2, class 3, class 4. सबकी property है इसमें. ठीक है? 1 means sodium channels पे भी act करेगा, block करेगा. 2 means on the beta receptors. 3 means on the potassium channels. 4 means on the calcium channel. So it blocks all these 3 channels and is a beta blocker as well, right? So it has a wide spectrum of action, and alongside, so it will have all these effects which can be seen with blocking these drugs. So what I want to tell you about this, it has a long half-life, 3 to 8 weeks. So it can be given for prolonged, it can be given for prolonged use also. And a very interesting point about this is that even though it's a potassium channel blocker and has properties of all these 4 channels, it has less chance of causing Torsades de pointis, less chance of Torsades T point. Somehow it has less chance of Torsades T point, as has been seen with this. But probably because this compound contains iodine. Okay, it contains iodine, and because of iodine content, it can, mess with the person's thyroid status. So thyroid status can be either there can be increase, can be hyperthyroidism, or can be hypothyroidism. So it can do that to the patient. Okay, uses, if I talk about the use, so they are very good drugs to be used because for the Wolff-Parkinson-White syndrome can be used. ठीक है, so extra impulses नहीं travel करेंगे. Or in case of the supraventricular arrhythmias. ठीक है, it has the property of the beta blocker also, won't allow it to pass into the ventricles. Now, its adverse effects, very interesting. So, if you could just make out they're very important to remember the adverse effects of Emyodrone. So, we start, if we start from the face, में the first important here हम आते हैं on the eye. Eye में क्या करता है? It causes corneal deposits in the eye. Coming down to this gland, it is the thyroid, so it can cause, dysfunction of thyroid. I told you it can be hypothyroidism or it can be hyperthyroidism. Coming down, if we talk about the lungs, what happens to the lungs? It can cause fibrosis, pulmonary fibrosis, or even pneumonia. Right? It can cause all those reasons. So what we do, we have fibrosis of the lungs. Okay? And pneumonia sometimes can occur. Now the next one, let's talk about what happens to the heart. We all know that because of the beta blocking effect, it can lead to the heart block. And you should definitely not use it in people who already have a pre-existing blocks of the and problem in the SC node or the AV node, right? Then what about in the GIT? Yes, GIT upset, ho sakta hai nausea, vomiting, anorexia and all that. And on the liver, it has a tendency to cause hepatitis. So see, they have a lot of side effects, but on the, the dose which is used, it will be nicely tolerated by the patient. And sometimes, what happens, this is a blue color, and on the skin, there can be slight pigmentation. So it is blue pigmentation of the skin, and you call the patient as this is called a blue man syndrome. So this diagram, because it's so important to remember the ADR, so you can remember the eyes, the thyroid, your lungs, almost all the major organs except the CNS and the kidneys, they're not affected. So heart, lungs, liver, GIT, everything is involved with this. Okay? So these are the important points about Emyodrone. Ibutalide, dofetilide. Ibutalide is given IV. This is given by oral route. So they are actually the structural analogs of sotalol. That's a beta blocker. But they have only class 3 action. Only class 3 action and nothing else. Okay? So that means only potassium channel blocking action. And they have the maximum tendency to cause TDP. Right? Maximum tendency to cause TDP. Then sotalol, it's a beta blocker. It is not a cardioselective beta blocker. So it has property of class 2 as well as class 3. But जो ये non-cardioselective beta blocker होता है, they're usually at low doses. High dose पे the selectivity gets lost. They can act even in the cardiac tissue. जब तक ये non-selective है, तब तक तो ज़्यादा इनका फर्क नहीं पड़ेगा. But that's at a lower dose. So it has tendency to cause potassium channel blocking also. So it has a tendency to cause the Torsades T pointus because it prolongs the QT interval and is pro-arrhythmic as such. So these drugs actually they can be used for atrial, ये जितने भी हैं, they are all used for atrial fibrillations or atrial flutters. They can be used in these cases, and they what they do is they prevent the re-entry because they prolong the repolarization. so they will prevent the re-entry. वो क्या कर देंगे, electrophysiological property change कर देंगे of the two pathways, of the one pathway out of the two pathways. तो फिर इससे क्या होएगा कि fibrillation of flutter में जब excess impulse pass कर रहे हैं वो re-entry हो नहीं पाएगी, because जब वो वापस आता है, you remember, जब री-एंट्री करंट वापस आता है तो अगर AV नोड पे there is repolarization, only then their pulse can pass. Depolarization में pulse pass नहीं हो सकती, so they will change that scenario. So these are the older drugs of class 3 that we have talked about. And please remember, the class 3 has one of the major side effects of this drug is increasing the tendency to cause torsion pointers, because they cause the QT prolongation and the repolarization is prolonged. So that is one important problem with these drugs. Out of this, the most important is the Emyodrone. And Emyodrone का हमें ये याद रखना है कि it is a wide spectrum drug and very half-life is very, very long, and still इसमें the interesting feature is that it has the least chance of causing the torsion pointers. Also, it contains iodine, so it can it can just mess with the thyroid as such. So corneal deposits है, eye में, thyroid में dysfunction है, lung में fibrosis है, blue pigmentation है, heart में problem है, block कर सकता है, GIT में nausea, vomiting etc. cause कर सकता है, hepatitis cause सकता है. So it can cause a lot of issues, but जिस dose पे हम इसको use करते हैं, it may not be that much of a problem, right? Ibutilide, dofetilide can be given in conditions, because it has only class 3 effect, and you can give it in atrial fibrillation, converts it into sinus rhythm, and it doesn't have a cardiac depressant effect because second class 2 action है नहीं, तो depressant action इसका है नहीं, but it has a maximum chance of causing the torsion pointers. Even sotalol causes torsion pointers because it has a class 3, class 2 effect आ जाता है cardiac selective अगर high dose में इसको use करते हैं for the anti-arrhythmic effect. So with this we end the class 3 drugs. ठीक है, we end the class 3 drugs now, and next we were going to talk about the class 4 drugs. So till then, take care. Thank you so much.